I'm Karen McMahon with Pig Health Today, and I'm visiting with Dr. Daniel Linhares, who is an associate professor at Iowa State University. Thank you for visiting with us today. I understand you've been doing some research at comparing PRRS outbreaks that happened 10 years ago with the hot ones that have occurred this last year. So can you tell us what you've learned and some of the facets of that research?
It's a program that we call the PRRS Outbreak Management Program, the PUMP program. And this study has different components. One, we just benchmark how are people managing PRRS outbreaks in sow farms. And then the other component is comparing how long is it taking for those farms to reach a low prevalence or start producing negative pigs again, and what was the productivity impact. The last component is we also did some whole genome sequencing in those farms, and the question is how many strains were there, recombinants with the wild type, recombinants with vaccine, diversity, how many unique strains, and how does that correlate back to those clinical measures, right? Time to stability, time to baseline production.
So what have you found?
So we saw different interesting things. One, people are, if you ask 20 different people how are they managing breaks, you may get 20 different answers, a lot of combinations, just indicating that people are not happy with PRRS virus, so still trying different things to succeed in their elimination or control program. So we saw a lot of variation between herds that close, don't close, use the LVI or live virus inoculation, right, with the wild type virus or vaccine, a combination of those. And in terms of the outcomes, we saw that the median time to achieve those negative piglets, defined as consistently produced PRRS negative piglets at weaning, it's taking about 10 weeks more than we observed in the past.
Wow.
Right? So median time to negative now being about 36 weeks.
And what do you think is causing that?
There are some factors that are associated. One, for example, is herd closure. If you do herd closure, defined as interrupt gilt introduction in the farm until the pressure of infection is low, right, and there's no more transmission going on. The farms that do herd closure, they achieve stability much quicker. The farms that had some prior immunity, either vaccine-derived immunity or natural break-derived immunity, those tend to achieve stability also much sooner. And so that there were some farms that were, I don't want to say doing nothing, but not deliberately vaccinating or doing live virus exposure. Those took much longer than the ones that did some sort of mass exposure. The ones that had some sort of batch farrowing in a either 2-week or 4-week interval, they achieved stability much sooner too, which makes sense, right? You're creating that all-in, all-out flow in the farrowing house. Another important metric is what's the severity of the break in terms of how many piglets did you not wean after the break. The PRRS impact in terms of piglets not weaned after a break was almost twice as much as what we observed 10 years ago. A median number for that total loss calculation that we compare number of piglets not weaned, it was about 2,500 per 1,000 sows as a median number, and today we're observing 4,700 as a median number of piglets not weaned, so much more severe
Right.
type of break, right?
So what's the assessment of this? I mean, the takeaway on this?
Yeah, for the time to stability or time to low prevalence number, there may be some of those factors that we talked about, but we also need to consider that 10 years ago, people were monitoring by bleeding 30 piglets once a month. And today, with processing fluids, familiar fluids, people are monitoring hundreds of piglets on a weekly or bi-weekly basis, so more sensitive monitoring, right? However, the productivity side, it's exactly the same metrics that we use, the same statistical process control, exactly the same method, and so there is real evidence that maybe a combination of different viruses circulating that, right, maybe more virulent, but also going back to the basics, people for different reasons, right, not that they're wrong, but not many people not closing the herd, not doing mass exposure. Those are factors that are associated with a less severe impact. So gotta revisit some of those.
You had a third facet of this, looking at the different variants.
We were submitting, asking the practitioners to submit samples at the beginning of the break, 10 weeks on the break, and then later on the break, just before they turn negative, and we're doing whole genome sequencing, so looking at the whole virus, not just a segment, right? What we've been observing in one herd and another herd and the next herd, and when we realize, oh, that's a norm, that's not an exception, is the farms are not infected with one virus. They're infected with more than one strain, and if you look closer in those strains, it's prevalent or common to find recombinants between viruses that are part vaccine virus, part wild type virus, or two different types of wild type viruses. Just another take home for practitioners that somewhere early in the break you may want to characterize which viruses you are dealing with, and then somewhere after a couple months or 3 months you want to double check again just to verify, is it the same virus that you're exposed to? Is there evidence of other viruses gaining ground in the herd? And if so, consider some additional internal biosecurity or biomanagement, biocontainment type of measures to avoid that virus spread. Because if you make it easy for virus to spread, they're gonna, gain ground again in the population, recirculate, and cause that second and third waves. Just another take home that biosecurity is important, but as important is the internal kind of biomanagement and biocontainment measure to prevent virus spread from litter to litter, from pen to pen, from room to room. You want to make it hard for the virus to transmit and gain ground.